This video introduces a completely new joint angle meter. It is really a one-handed, accurate angle meter. Please put it to good use. The problem's so far been about goniometer. At first, can you really measure with one hand? Second, can you align the two axes accurately? Third, can you measure both sides consecutively? This goniometer has solved those problems. Sharp serrations were added to the rotation axis. Complete one-hand operation is now possible. It predicts joint angle in 15-degree increments and allow you to set the angle with one hand. And the center line of the moving axis has been set to 30 degrees. In fact, the correct line seems to be 5 degrees further outward. The system works as follows. Lines are drawn in a fan sharp at 5-degree intervals from the center line of the moving axis. By adding or subtracting the angular error from the centerline angle, the actual angle can be determined. That's why there's no need to rotate it, just a simple parallel shift is enough. The front and back are labeled in red and blue. If there's a red label, please read the red text. If there's a blue label, please read the blue text. Cervical rotation. You see from the top, the angle indicate was initially estimated 45 degrees, but due to one additional tick in the positive direction, the final angle was determined to 50 degrees. Shoulder girdle elevation. In this case, the angle was estimated less than 30 degrees. The angle can be measured by making a straight line between the lowest line on the moving axis and stationary axis. That's because protractor was available. Shoulder flexion and extension can be measured easily. In this case, the stationary and moving axes are reversed, but this does not cause any problems. Please feel free to explore various convenient ways to use it. Shoulder external rotation can be measured without any problem. Simply align the stationary axis parallel to both acromions. This goniometer can measure the wrist and the MP joints, but it's harder to do with the interphalangeal joints. You can read the angle without moving the arms of the goniometer, but if necessary, open it to 15 degrees to measure up to 30. In hip extension, if the angle is within 15 degrees, you can read it with the goniometer kept closed. For angles is greater than 15 degrees and less than 30 degrees, you can use it like a protractor. In hip abduction, the goniometer is applied from the front. Since the normal ROM is 20 degrees, it is usually not necessary to move the goniometer. In hip internal rotation, the movement axis is rotated 90 degrees and applied from the front. If the person has tight muscles, the angle can often be read in that position. In ankle dorsiflexion, rotate the movement axis 90 degrees, align the stationary arm with the sole, and look for the vertical direction along the projected path of the movement axis. In this case, it reads 5 degrees. Here are some special measurement techniques using the Smart Gonio, which I came up with through hands-on clinical practice. In forearm supination, preset and align the stationary axis parallel to the radius and ulna. In this case, the angle was estimated in advance to be 45 degrees. Finally, you should select the vertical line of the moving axis. In foot inversion and eversion, these methods are similar to the procedure used for the forearm. As you can see in the diagram, all you have to do is attach the stationary axis to the sole of the foot. Thanks for watching till the end. We hope this helps you get the most out of Smart Gonio.